Depending on where you live, you may be witnessing firsthand this rise in violence across the United States. Data showing homicides in major cities increased in 2021, including New York, where the murder rate shot up by 47% since 2020. And now a recent incident has once again raised fears after a 35-year-old Asian woman was followed into her apartment and stabbed more than 40 times. The suspect, a homeless man with a lengthy rap sheet, calling into question the country's justice system and how we deal with mental health. Joining us for a deeper dive, former NYPD chief of detectives and ABC News contributor Robert Boyce, as well as professor of psychiatry and health director at UConn Health Disparities Institute, Wizdom Powell. Well, Wizdom, you are a producer of sorts. That's true. You help us create good discussions. Slip of the tongue there. Bob, let's start with you. You know, this suspect, I mean, it's grisly, this murder in New York. It had extensive record, this man. 3 open cases in Manhattan dating to last year, including third-degree assault, which makes him ineligible for bail, yet here we are. So how do you make sense of why he would even be released?
So, Kira, thanks for having me on today. We are in the throes of a mental illness crisis in New York City, and people are afraid. I live in the city, I walk about it, and I see the look on people's faces when you walk by on the sidewalks. It's a terrible thing. So here's the thing with homicide Nash, excuse me. He was before a judge 3 times before this incident. 3 open cases, he was released. Clearly, if you see the man, he's in a crisis mode right now of mental illness. Why was he let back out? Why? Because a judge can't hold him, can't remand him, or can't levy bail because of his dangers as a community. That has to change. You'll see this when you go out to the subways, homeless people lying about, sleeping there. It's not fair to them either. This is a horrible condition. One of the worst murders I've seen in a decade here. You know, we see Brian Watkins and Kendra Webdale. These things happen. It created change. This needs to change. We have to get out in front of this. I don't know if this is inherited by the new mayor, of course, but it's not only that. He's up 71% in crime last week. I did 35 years in the police department. I've never seen that number in a singular week. So this is a real crisis. We have to address it, but we need help from Albany so we can change the law, or at least alter the law to make some changes in it. So that has to get done right now, and it doesn't look like it's going to happen.
So, okay, so just everything you just said sounds like we're not going to make any progress here. So, Wizdom, this is where I'm going to bring you in. You know, what needs to be done? If you can't change the law, what do you do? I mean, I have witnessed over the decades many people with whom I know dealing with mental illness and needing help. And it seems like if you don't have anybody looking after you, or you don't have any advocates, and you don't have money, it's nearly impossible to get the help that you need. It seems like all these mental institutions of some sort, many of them private, you've got to have a lot of money to get help.
Absolutely. You have to be extraordinarily connected and agentic to navigate the complex mental health systems. And I use systems plurally here because they're not connected. Our systems are largely fragmented. And often what happens is that law enforcement end up being the first line of defense for mental health issues, and that has to change, as we've already lifted up in this conversation. I think that one of the fundamental challenges for us right now that we have to face as a nation is that we do have a labor force and a supply chain sort of challenge. We are not training enough mental health professionals to meet the demand. And the way that care is delivered is extraordinarily disconnected and difficult for people to find. So even if you identify that you have a problem that you need a resolution for, finding a provider who can meet you where you are and actually address your problems comprehensively is still a challenge. So we have to really democratize our mental health delivery systems. And by that, I mean this strategy of treating one patient at a time, one family at a time, is not tenable or sustainable. We need more innovative solutions, and we need partnerships with private entities who have the scale, the capacity, and the resources to deliver these services in innovative ways. There's a new wave now around using digital mobile health applications, which I think aren't the primary solution. We still need brick and mortar facilities, but they can help mind the gap.
Right. Yeah, we do need the brick and mortar because people need to have a place to sleep and get 24/7 attention, clearly. Bob, let's talk for a minute about bail reform. There was this November 2020 report from the Prison Policy Initiative, reviewed 13 states with reforms in place, including Washington, D.C., where we are, New Jersey, Kentucky, and it found that all but one of these jurisdictions saw decreases in crime after implementing reforms. That one jurisdiction was New York. If we see bail reform working across the country, then why do you think it isn't working in New York?
Well, I tell you, I think that it was too broad a statute that was written. There's nothing wrong with it. We're trying to decrease pretrial detainees, and that's an altruistic pursuit. But it has to be done intelligently. So you can't have someone who's arrested for burglary immediately go out with no bail at all, immediately re-released to the community. He or she's going to keep doing that. Robbery too. Every misdemeanor has to be let go. So we're seeing things like people stealing outright because they know they're going to get out the next day. So the law was written way too broadly. It should be taken a look at, but it's not going to happen because no one's budging. The mayor went to Albany Monday and was rebuffed and said, no, they weren't going to do it. He won't admit that, but that's exactly what happened. So we need just a little change. It needs to be tweaked. Nothing wrong with bail reform. Let's get it done, but also let's be intelligent about it. Let's understand what just happened since 20. This was written April 1st, 2019. In 2019, it's April Fool's Day, by the way, and it was written that day, and it was written poorly. No one's asking you to throw it out. Just tweak it so it's more just. We keep the public safe. Because now it's not happening. Also, we're the only state in the country that a judge can't do risk assessment, the danger of the community when he's leveling bail or remanding the subject. That has to stop. Why are we the only one in the country? These things can get done, but I don't think it's political will to do it. Now you can have people write their state assembly or state senators. That's a good idea. Let them know how you feel. Send out those letters because that's what democracy is all about.
Yeah, public pressure. You got to do it. You really do. Final thoughts, Wizdom, from you. When we talk about rehabilitation, I mean, clearly this incident in New York, this man had been released numerous times. He ends up stabbing this woman 40 times. It's just a horrendous situation. But for those that are in jail, have you seen any type of rehabilitation that's effective once someone that needs the help is in jail? Does it exists the way you think it should? And I know it differs, from state to state. It's hard to get something of like mind.
Absolutely. And you just lifted up a really important point. There isn't a lot of strategy alignment across carceral settings around how we're going to treat individuals who are mentally compromised. And there isn't a strong transition assistance program for those folks when they re-enter communities to keep the continuity of care. So there are a lot of places where people can get fundamentally lost in the system. I want to also underscore that while we do know that there are, this situation in New York, for example, with Christina Lee and the tragic murder that we are bearing witness to, we still have to keep in mind that homelessness doesn't necessarily mean that a person is going to be mentally challenged, right? And that mental illness is necessarily a correlate of violent behavior. And I think that gets conflated a lot as we're having these conversations. It's often difficult to disentangle them, but it's important for policy solutions, right? So that we don't overly pathologize individuals who are homeless, and we don't presume that every single crime that's committed or violent act has a mental health underpinning. That's important, that we don't blur those lines. But at the same time, I think that we have to pay attention to the canary in the mine. This is a sign to us, a signal that our systems are broken and that people are suffering, and that if we don't assume responsibility for the systems that people navigate within, then we're going to see many more of these instances, and we're going to be grappling with a far greater problem. Again, my heart goes out to the family of Christina Lee. Tragic loss of life. Should not have happened. We failed her.
Former NYPD Chief of Detectives Bob Boyce and Associate Professor Wizdom Powell, appreciate you both so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.